42. So this week in our readings, we learned about the major diseases and events that affect the cardiovascular system. The question posed this week in discussion was why the phrase "time is muscle" is so important in a STEMI patient, um, commonly known as a heart attack. Um, so what happens in a STEMI is the blood flow from one of the major coronary arteries in the heart is completely blocked off, which causes ischemia and death of the heart muscle. And the longer that this ischemia and lack of blood to the heart goes on, more and more tissue or heart muscle dies. And if enough of your heart muscle dies, and depending on where your blockage is in your coronary arteries, this can cause arrhythmias and eventual death. Because this can happen in as little as 20 minutes of prolonged ischemia, every uh, every minute muscle's dying, so hence the term "time is muscle." Um, so during the course of the readings, one of the lecture slides by Dr. Magdi Sassi, I liked how he broke down the patho for MI, basically stating that the plaque builds up, is then thinned by chemical and physical processes, which then lead to a thrombus or a clot, and this then leads to a MI. Another article that I came across that helped explain the patho of a coronary artery disease talks about the lesion formation and how inflammatory processes associated with bacterial infections and certain diseases like high cholesterol and high blood pressure um, actually increase the risk for these arthrosclerotic lesions. And more lesions also lead to increased risk for an MI. So I'll have those references for you. Um, yeah, so this is an interesting, a good review um, for MI. In my clinical practice, I typically deal with at least one or two MI patients a week. We have a cath lab where I work, and getting them to the cath lab in a timely fashion is always important. So it's a good review to because you can during your just day to day stuff you can just forget about what the why of what you're doing and just kind of get focused on tasks. So it's definitely a good review for this. All right, hope you guys have a good week.